Good afternoon. Thank you for joining us today for the Calhoun County Unified Command's weekly press update. Public information review from the week in the past and where we see ourselves going this week in the future. And fortunately, it's a somber update today. We've seen 6 consecutive weeks now of increase in positive cases throughout the county, and not just a few additional positive cases. We're talking many new positive cases. We currently have exceeded the 1,500 mark of cumulative cases throughout Calhoun County, and the number right now stands at 1,560 positive cases over time in our communities here. 720 of these positive cases have been in the last 14 days. Think about that for a minute. Almost half of all positive cases in Calhoun County have come in just the last 2 weeks. That is concerning. That is alarming. That put us back into the very high-risk category according to the Alabama Department of Public Health. When you look at the highest daily totals, this past Thursday and this past Saturday were the 2 highest days so far for cases in Calhoun County. On Thursday, we saw an addition of 110 cases, and on Saturday, an addition of 97 more cases. We're averaging over 50 cases, new cases per day, every day. So as we're in the very high-risk category, it starts to show, not just in positive cases, but also in other impacts in the community. One of those being deaths. So according to the official count that ADPH investigates and keeps us up to date with, we remain at 9 official deaths. Unfortunately, this is not all that we know of. We know that there are additional probable deaths being investigated now by the health department. There are 2 that have not been reported yet or recorded yet from the previous week. But when we look at this past week, including the weekend, there have been 9 additional deaths in Calhoun County that we're aware of. 4 of these appear to be hospital deaths. 5 of these appear to be long-term care facility deaths. This brings us to a total of 20 total deaths that are known in Calhoun County. 9 of those are official. The remainder of those are being in the process of being reported and being investigated to determine if they will be official. But the sources at each of these facilities tell us that we are up now to 20 deaths throughout the county. Late last week, the Unified Command did become aware of some positive cases at some of the long-term care facilities throughout Calhoun County. These positive cases do involve both residents as well as staff in these facilities. They have reported, thankfully, that the majority of the cases that they are seeing are currently asymptomatic. The Unified Command has communicated with and offered assistance to these facilities and stand ready if the need arises. We're here to serve, obviously, in any capacity. We've communicated with the Alabama Department of Public Health, and they have a bureau that specifically supports long-term care facilities in these areas, and they'll be working in the coming days to make contact with and provide those relative resources to the long-term care facilities. As we continue to have very high community spread, we continue to see deaths, and we continue to see these new cases. Obviously, the hospital continues to be heavily impacted. At this time, we're going to hear from a number of our hospital officials, both the CEOs as well as the physicians that are on the front lines. So at this time, I'll ask Mr. Lewis Bass, CEO of RMC Health Systems, to come and speak. Lewis?
Thank you, Michael. I'm going to give everyone an update on where the hospital stands at this time based on relative to numbers. As of this afternoon, we currently have 48 COVID-positive patients in the hospital. We have 13 of those patients are ICU-level patients, and 11 of those patients are vented. We also have 14 vented patients hospital-wide. In the last 14 days, our average daily census has been 46 patients. We've had a high of 49 and actually a low on Friday of 41. We actually thought on Friday that maybe we would start trending downward, but over the weekend we had a significant number of admissions and it pushed us back up to our current 48. So far we have had 55 admissions over the last 14 days. And to compare that, for the first from January 1 through late into April, we had only had 24 admissions through that point. So we've had 55 in the last 14 days. As Michael said, we did have 4 deaths over the weekend. Our staff has worked very hard. That's been a heavy toll on our staff to have that to have occurred. The average age of our patients that are currently on the unit is 66 years old. Currently, we still have a 95-year-old, and our youngest patient is now 39. The bulk of the patients, over 50% of them, are greater than 65 years old. I did want to comment, our physicians here will talk more specifics about the treatment and how things are going. But from a staff standpoint, I do want to let you all know how hard and how dedicated our staff is and the things that they've been dealing with over the last week, from the emergency room up to the units and throughout this hospital. Our folks have just been working almost double time, not necessarily literally double time as far as hours, but in what they're trying to do and to take care of patients. And they have been just amazing in what they've been able to do, the things that they've been able to do for our staff. I ask you sometimes to be considerate of them and the pressures and the workload that they have on them, that sometimes it may take them a little longer to call back or to reach out. And it's not that they're not wanting to do that, but it's that they're busy. They are very busy in the things that they do. Be mindful that when patients pass and patients get discharged, there's a lot more that goes into the cleaning of the room and the preparation of the facilities so that a new patient can be admitted into that room. And that ties the staff up. And so they very much want to meet and serve everybody, but at times, sometimes it is a little difficult for them. So just kind of be mindful of that. I ask that for the public. But overall, the morale is very good. I think the morale is high throughout the hospital. We are continuing to manage what we have, and we're trying to move forward. So with that, Joe?
Thank you, Lewis. I've mentioned in the past that Stringfellow has served in a support role for the main campus, but what we're starting to see now is that we're starting to have issues of our own, not necessarily with COVID patients, but with those patients that are coming in with conditions that are non-COVID related. Back when this epidemic started, I guess late February, early March, our emergency room was only seeing about a quarter of the patients that it would see on average. Now we're back up to around 85 to 90% of our previous volumes. In the past, a lot of those patients would have to be transferred here to the main campus, but as you've heard individuals speak regarding capacity issues here, we don't have that luxury anymore. And as a result of that, we're starting to see patients whose level of illness is becoming increasingly more severe that we are keeping at the Stringfellow campus. Our ICU has been at capacity for a significant number of days now, and we don't see that changing at any time in the near future. I'm sure that you're going to hear some appeals later on from some of the speakers that will talk to the staffing issue, and that's fine and good. But what I would say is that we need to try to be more proactive. The staffing issue is a back-end issue. The mask wearing and social distancing issue is what we really need to see from the community, and that's the appeal that we will continue to make. I live here in the area, obviously, and when I'm out in the community, I still see a lot of people who are walking around without masking, without social distancing, and I'm here to tell you that that is a very, very serious issue that can not only affect you, but could certainly affect your loved ones as well. So please make sure that you continue to adhere to the social distancing guidelines. That is the only way that we're going to place ourselves in a position where we're able to stem the flow of this deadly virus. With that, I'm going to turn it over to Dr. Free.
Good afternoon, everybody. I want to say thank you to the community for helping, being vigilant and helping us. And I agree with Joe. When you go out and see people without masks and they're in groups doing as they do, it creates a big, big problem going home. I have a patient that I just admitted, and this is a 33-year-old, just admitted 5 minutes ago. COVID positive, whose brother was COVID positive. He, you know, was in the environment of other people, and we want you to realize that you've got to take this seriously, because when you become sick or you're around other people that are sick, you're taking that virus home, and then you're getting the disease. I wanted to just reiterate on what we find in the hospital. Again, I wanted to say thank you to the community for bringing food and props to our staff. We appreciate it. We really need it. It's giving us a boost. On COVID-1, we have, again, 13 ICU patients with 11 vented, 8 med patients, and we have ICU nurses as well as regular nurses helping there. We still find that we need nurses in the rest of the hospital, both hospitals, so if you would like to help us, please. We don't necessarily need you in the COVID units. We have other units that we could supply nursing to. And if we had more nurses, we can get more patients in to the regular hospital. In COVID-2, we have 17 patients. There is one that's going to be discharged, but I have a strong suspicion this gentleman that I just admitted to the ER will be going to COVID-2. COVID-3, we have 10 patients, and we are going to be able to discharge one to a nursing home with hospice, and one to home isolate. If you should find yourself going to an urgent facility or emergency room and you test positive for COVID and you have mild symptoms, be careful. Wear a mask, self-isolate, wash your hands, do not get around people. If you have sick people at your home, you've got to find a place that you can quarantine safely, because if not, you're going to spread this virus. Again, I can't stress enough how that should be. If you have symptoms that you find, fever, cough, congestion, shortness of breath, pleuritic chest pain, which could be knife-like feelings, go to an urgent facility or talk to somebody to get some help. Get some help immediately. Don't let this virus or this type of disease prolong, because you can get into trouble. And I wanted to say something about what Louis Bass was saying. The ER wait. We do have an ER wait, unfortunately, because we're focusing on taking care of everybody. Please be patient with us. Please help us. We're doing the best we can, and that's all I can say about that. I admire everybody for pulling in together, the Unified Task Force, EMA, the doctors, administration. We're doing the very best that we can. We must continue to educate the public. If you are out and you see people without masks, please just kindly say, wear your mask. If you've got sick people at home, you're going to get people sick, or you're going to get sick. Just remind people, because this is what's going to help keep us more stable. I'm going to leave this to Dr. Magadia.
Again, I'm Dr. Magadia. I'm one of the lead clinicians in the COVID ward, being the infectious disease specialist. From what I discussed last week about the therapy, I'm also tasked in coordinating treatment and treatment regimens. I briefly talked about remdesivir last week, which is pretty much the only antiviral therapy that we have available right now. We do have some medicines or drugs that could help them. These are what we call supportive or symptomatic care, including high-dose vitamin C, thiamine, zinc. We obviously give them IV fluids. We also are involved in some clinical trials that I'm not privy to talk about right now. There's some talk about convalescent plasma. We're looking at that. Right now, FDA classifies that as experimental and therefore can only be given inside a clinical trial. But we're looking into that. There is some usefulness on that in the inpatient setting as well as healthcare workers as a prophylaxis. There's also some talk about high-dose steroids that we are giving right now. The steroids that we're giving right now is kind of mild to moderate dose, 6 milligrams. We're looking at giving them high dose. There's also some questions about patients on non-steroidal anti-inflammatory drugs like Motrin, Aleve. The basis of that is there's some animal studies that suggest that those non-steroidal anti-inflammatory drug could upregulate ACE2 receptors. Those ACE2 receptors are the receptors that this particular virus attached to. But on human trials, that did not really pan out. So those people who are taking non-steroidal anti-inflammatory medication, for whatever reason, we recommend that you do not stop them. It's the same thing with ACE inhibitors or ARBs for blood pressure or cardiac conditions. We recommend that you do not stop them unless told so by your physicians. Other than that, again, we give them supportive care. We give them a lot of IV fluids. We give them vitamin C, which is also the same recommendation that we give in an outpatient setting. And this time, we give them by oral. We give a 1,000 milligrams of vitamin C twice a day for at least 2 weeks. That's born out of different studies, although it's not really officially recommended right now, but the multiple hospitals are doing that right now. Outside of that, the only thing that, and I said this emphatically last week, outside of that, there's only 3 things that I could tell you that could prevent you from having this. Social distancing, wearing a mask, and meticulous hand hygiene. I don't like for you guys to be my patient, but if you so happen to be infected with this, those are the only things that we could do, but please do those 3 things. Thank you.
I'm Dr. Rohit Patel. I'm Pulmonary Critical Care, Director of ICU, and I'm here to tell you about the end spectrum of the disease process where we deal with. And first of all, I would like to thank, as Mr. Bass has said and all the doctors have said before, that we cannot do without our staff. We have an excellent nurse practitioner staff. We have excellent ICU nurse who have been trained for average of 15 plus years, and they're willing to work. They're willing to work hard, and they're overworking. So I cannot thank for them. Without them, we would not be able to do what we are doing right now. So that's number 1. Number 2, we have a good success rate on the ventilators. For instance, we had intubated a lot of patients back a week ago, and we were able to get 4 off the ventilator, and we were able to put 4 back again on Saturday. So it's just kind of a cycling, but we have probably, I would not be able to tell you exact rate, but we have 75% success rate in people who are relatively healthy and not that many comorbid conditions. Other thing, when we talk about the deaths, we have to be careful because there are some of the deaths are not directly related to COVID-19. They are the deaths of something else which can cause patients to die, but they are somehow positive for COVID-19. So sometimes we have to be, our number data gets biased because of that. Other thing I want to mention to the community is that we have an excellent staff. We have state-of-the-art respiratory therapy department. We have no problem with the ventilator so far, and their respiratory therapy staff is willing to work 24/7 round the clock. As for instance, there are 3 respiratory therapists on the unit right now. They're available all the time, and they take all directions from us, all the critical care doctors, and then manage the patients on the ventilator. So we have an excellent team around here. We have a good success, in my opinion, over time, and we have better experience. And with the help of Dr. Magadia and the team of primary care doctors, we're able to take care of them. Those are the things I want to mention about the critical care. So we have a good success over here. Thank you.
All right, thank you all for sharing with us your information that you have. And in just a minute, we'll take questions from our speakers today. But I want to follow up on one point that I think you heard almost everybody up here say in terms of the things that we can do to prevent the disease. And we won't belabor on that point, but I want to take you a step further and talk about if those efforts fail and you do get it, what are you going to do? Think about having your COVID plan for yourself and for your family. Where will you go if you get it? How are you going to have, where's your supplies coming from? What network do you have around you that can help bring you some of those things, can check on you to make sure that you're doing okay and that you don't need anything? Where are you going to be tested at initially if you start having symptoms? So all those are things that can be planned, pre-planned, and those questions can be answered before the event ever happens in your life. It's just like when you think about a tornado and severe weather safety. We talk about our severe weather plan. You could also have a COVID plan of what you're going to do, where you're going to go, so that you can limit exposure to your loved ones that you may live with. We have heard numerous stories over the past week of an individual in a household that does contract it. They go home, and unfortunately, their family members get it as well. If you can identify it and isolate it prior to exposing the rest of the family, then that's many more people that potentially have been saved from being infected by it and potentially being hospitalized for it, and also potentially from passing away from it. So your COVID plan is something, if you don't have, we encourage you to get it formulated and do it right now. The final comments that I would have is from our Unified Command. The Unified Command stays obviously very active and engaged with all the things going on, from the hospital, the long-term care, to the education, to all the things supporting the public safety. I'll reiterate our priorities that we have, that we've had from the beginning of this, is first responder and healthcare worker safety and support. That's number one, because we have to take care of the people who take care of us, and that's what we continue to do from the Unified Command. Current data is very important for us to gather from a number of sources to know what is really going on in the community, be able to educate our decision makers on it, and educate the public on it as well. Capacity of care and readiness for response are critical in making sure that there's people and places to take care of folks who do get sick, and not just from COVID, but also from all the other things that do continue to go on. As we've said many times, heart attacks don't stop happening and car wrecks don't stop. They just add to what we're seeing with this infectious disease right now. Supply of critical resources. We've talked about staffing and how important and how beneficial it is to have good staffing and good personnel on hand, and we do have that. But there are some needs, as Dr. Free talked about, and we continue to work with our regional partners, state partners, and in the process of making a federal request for assistance for additional staff to come in and help to relieve some of the stress that we've got on the local system here right now. And then lastly, of course, promotion of a safe reopening and the ongoing of business, those preventative measures that we've talked about, and those things that we continue to labor on in our communities. So with that, we'll take questions from both the Facebook Live audience that we have today, as well as any of the media that are present with us now. Yes, sir, Tim.
The deaths that you've told us about in long-term care facilities, what facility or facilities did those occur at?
So I'm not going to specifically name any facilities. In our conversations with them, they're going to take care of, making that information public with their corporate offices. What I will tell you, the effects that we're seeing from that throughout the county seem to be narrowed right now down to 2 facilities throughout the county. And we do, of course, continue to offer our assistance and support with that, as well as does the State Department of Public Health.
What cities are those?
So I'm going to refrain from commenting any more on it. We look at the big picture in the county, and then, of course, provide those resources as requested. So far, none of those facilities have specifically requested in-depth resources from the Unified Command, and so we continue to be a supporting role for those at this time.
Is there a common factor as far as where these cases, these new diagnoses may have originated? Did they originate at family reunions? Did they originate at church? Did they originate at bars? Anything like that?
So it's hard to tell from the vantage point that we have at the local level. As we've talked about in weeks past, the Alabama Department of Public Health does contact tracing. We offered to do that at the county level and had some resources in place to do it. But they declined that, so they maintain that and they monitor that at the state level, and unfortunately that information is not flowing to the local level. So the problem with that is then our ability to go in and provide intensive education or resources in those areas where those cases are actually developing at.
There was mention earlier of, first of all, if you test positive, you should wear a mask, and even if you're not symptomatic. And you mentioned people getting ready to have supplies so they can stay at home. Are y'all seeing cases emerge from that situation? Somebody gets a test, they're not symptomatic, they just go on about their business.
So I let one of the physicians speak to this if you want. I do know that we have a number of asymptomatic cases, that are out there in the community, and if any of y'all want to address that, be glad for you to.
We have quite a few people getting admitted to the hospital for a totally different reason. And for whatever reason, whether it's might be related to it indirectly or directly, we get them tested. Somebody fell, broke their hip, and they have something on their chest x-ray, a little bit off on their labs. We do test them, and they're completely asymptomatic, no fevers, no nothing like that. So we label them as asymptomatic COVID. Although they are still staying in the hospital because of their other comorbid conditions, their broken hip, they have a urinary tract infection, but we label them as asymptomatic COVID-19.
are you seeing people who are testing positive and then just going out in the community because they're asymptomatic and not wearing a mask and that sort of thing? Are you seeing transmission because of that?
I'm mostly a hospital-based physician, so I'm not privy to that information. Although literature suggests that, if you go back to the South Korean literature, 42% of their COVID-19 positives were asymptomatic. So then again, that's during the first wave of pandemic. So I'm sure it's going to be kind of the same thing, same number on the second wave. Again, I don't have personal experience on that because I'm mostly a hospital-based physician.
I'd like to address this question to one of the doctors. Have y'all run across any patients who contracted this a second time?
As a matter of fact, I have two of them right now. One actually, we admitted the first wave had multiple negative testings prior to discharge. This was back in maybe early May, and came in about 2 weeks ago again for a totally different reason, different comorbid condition, and was tested again and tested positive. The rationale behind that are multiple. One is there might be an issue about testing, so there might be a false negative testing. So the negative testings back then might be false negative based on the testing itself, the duration of the timing of testing, the actual technique of testing, because you have to swab them all the way to the mid-turbinates, right around your almost to the eye. We have a standing joke that if they did not cry, you did not do it right when you swab them. The other possibility is the immunity. The data from NIH suggests that there might be immunity somewhere from 3 to 6 months. And if that patient had true negative testing back in May, June, July, August, so this positive testing might suggest that the immunity wanes. So this kind of comes along that the idea of, maybe I should get myself infected so I'll be immune and I could, go out and do whatever I can do. That's maybe completely wrong because the immunity might wane. So, immunity depends on a lot of things, including your age, your comorbid conditions, your medicines and things like that. The one that I'm alluding to is a guy in his mid-40s, so he's not an old person. But if you think that his immunity waned, you could make an argument that his immunity actually went down and completely was gone in about 2.5 to 3 months. So we are seeing that. Not a whole lot. Personally, I've seen two of them.
I have a question for you, Dr. Magadia. Would you recommend people who are in a high risk of 65 and older be tested to see if they're asymptomatic?
So during the early part of pandemic, we did not really recommend that. There was some strict criteria by CDC and FDA because of different things, including the availability of supplies and kits. Now they have kind of loosened up that criteria. Again, we have a standing joke that, if the only criteria for testing is if you have a nose. So if you have a nose, we could test you. But then again, there's a caveat to that. You have to meet certain criteria. If you belong to that demographic of, 65 and above, you have multiple comorbid conditions, diabetes, particularly uncontrolled, history of cancer, nursing home residents. We do recommend, especially in the context of rapid spread in the community, that you get tested.
Can you reiterate why the cases may be increasing with the mask order in place?
So again, maybe one of the physicians can speak to that. Dr. Free?
Even though the mask order is there, we still see people out in the community without masks. There's even a question whether you should wear a mask at home. If you're in a vicinity where the virus is rampant, if you work in the hospital and you're going home and you've got people that are sick, you've got obese people at home, you've got people with heart disease, diabetes, COPD, on oxygen, people with cancer, you probably should wear a mask. We are not with people every day. We're not with them every moment. You may forget. You may just be, haphazard and not even think about it, or you just may not even care. And those are the people that can spread the virus and get sick themselves. So it would be nice if there was some type of program that would cause people to wear the masks more. I just wish somebody could come, if this was in a utopia, someone could come to the hospital and see how sick these patients are, see what all we have to do to get them better, see the waxing and waning of their symptoms and their problems. You'd wear a mask even in the shower. I mean, this is no joke. This is a really sick disease, and if you get sick enough and you develop that cytokine storm, you're in trouble. And sometimes so much so that we can't even help that trouble. So wear the mask. That's all I have to say.
Any other questions? All right, well, no other questions today. I'd encourage you to keep up to date with the latest information. The best way to do that in Calhoun County is through the Calhoun County EMA's website. It's got all the unified command information on there, calhounema.org. We're also on social media platforms of Facebook, Twitter, and Instagram. And of course, if you need something and we can be of assistance, feel free to call 256-435-0540. And the 211 United Way helpline is always available 24/7 for folks to be able to call and get non-emergency assistance. So thank you, stay safe, and have a good day.